The first thing is, I think this is a human challenge. It's not just an India challenge. One of the things we learned in school, I grew up in Pune, one of the things we learned in school was cleanliness is next to godliness. And I think what we're seeing, particularly all around the world, is the idea being reinforced that hygiene is the foundation of health. It just is the foundation of health. Just to give you a couple of statistics that might even surprise you, just around the statistics from around the world. The UN did a study a few years ago and concluded that only 17% of people wash their hands after they've used the bathroom. This is a global number. Now, you might think this is an India issue, but it's actually 17% around the world. Now, people may think it's a developed market, must be more involved, but in the UK, there was a study done by the London School of Hygiene and Tropical Medicine, which said only a third of men and 2/3 of women approximately essentially wash their hands after using the bathroom. So this is something quite foundational and fundamental. It gets to the heart of behavior change. Now, in a country like India, particularly, where water is a challenge in many parts, one has to be extremely conscious of what is it that one can do in order to keep our hands clean. Soap is good enough. Hand sanitizer is great, but soap and water is good enough. Now, we've been fortunate over the last few months. The government has been tremendous in partnering with us on a whole range of public service announcements with some very famous people. We also did a campaign on TikTok, because what we want to do is to engage people and bring them in and have them participate in this idea around what it takes to drive behavior change. The Dettol TikTok hand wash challenge has had 36.4 billion views, if you just think about it. So people are engaging with the simple idea of saying hand washing is important, ensuring that your hygiene in your home is very important, and that is at the foundation of good health.
Right, and we've been saying, you got to, what everybody's saying, wash your hands for at least 20 seconds, sing happy birthday, but better than that, sing Hakim Tarajan or sing Robindu Sangeet or something for at least 20 seconds, except only Robindu Sangeet goes on for about 20 minutes. So if you wash your hands for 20 minutes of overdoing it a bit. But one thing that's encouraging in the midst of all this is a feeling of togetherness, and not only people but even corporates are coming forward. They realize their responsibility. So we shouldn't just depend on the government doing things for us. We got to do things ourselves, right?
I couldn't agree more with you. If I just go back into the history of my company, Dettol was founded in 1932, and the goal was to reduce sepsis by 50%. We have another brand called Lysol, and sold in India. Started in 1889. It was important in the cholera outbreak in Europe, and also in the Spanish flu. Now, as we've gone around and thought as a company about, why we exist, we exist to protect, heal, and nurture in this, relentless pursuit of a cleaner and healthier world. And our young people in the company defined access to quality products, information and behavior change, what you referenced, as well as product availability as our fight. What we need to do is put our money where our mouth is. And what I've done, along with the board of the company, is we've essentially set aside 1% of our operating profits of the company in order to ensure that we can put the money behind this global fight for access. In India, what we are doing is, we're donating 10 million units of bar soap, about 1 million liters of Harpic and Lysol. We are going to be donating 3.5 million masks, what you just referenced as being a really important element of this. And we're putting money into behavior change, including this TikTok campaign and other things that we're doing, in order to ensure that we can help our consumers, help our customers at this point in time. Corporates can't stand back. They have to lean in every way they can to make a difference.
Absolutely. Mr. Narasimhan, another thing is, हम सब लोग अब घर से भी काम करने की एक नई आदत डाल चुके हैं. How are you and your company, colleagues, and how have they adapted to this?
Work from home.
Well, the first thing about working from home is you have to realize there are a lot of people who are still going to work. And I have a lot of people in the front line in the factories, in our distribution centers, who are working tirelessly to ensure product is available. So the first thing is a shout out to them. Because what we've done with them is we've really taken up the level of safety, ensuring they have access, check, trace, test, isolate where need be. with medical support, so that overall, just ensuring that our front line is protected. That is my first priority. Working from home has meant three big changes. One, there's no question that we have an adoption of IT and technology to make us work better. I think Pranay, you talked about this yesterday as well. We're working from home. Our IT teams have really stepped up, both us and our partners, to ensure that we can make that happen. We had a time when some people didn't have the ability to do this. India, you live in homes, sometimes you don't have the space. How do you ensure people have access to the right connectivity, the right PCs in order to be connected? Technology also for my senior team is a big thing. But the thing about technology is that while it's great and I can stay connected, nothing goes for the second element, is personal connection. I've got roundtables going on with talent around the world. I did a meeting 3 days ago. It was an informal thing with our plant managers, our factory managers from around the world. We've got to stay connected with people and ensure that just because you have technology and all these meetings scheduled, you don't forget the idea that you have a personal connection. Some people get embarrassed about, this video at home. And so we started something called, turn the camera on, which in effect means that, as we think about this idea of bringing your whole self to work, you shouldn't be embarrassed. If your child walks in or if the child says something and, it's there in the background. I live here with my 79-year-old mother. And there has been, more than one occasion where my mother has told me off for not having done a chore, and I've had to take care of it. So I think we just have to be very comfortable with the idea that life is just going to be what it is. And the third thing I would tell you is, while we focus on physical health, we must also think about a lot of people lack connection, and how you ensure you make that happen is very important. So we put programs online through things about mental health. So technology, personal connection, as well as both physical and mental health are three things. It's fundamentally changing the way we work, though.